true success is not in the learning, but in its application to the benefit of mankind. For Thailand, much alertness and importance have been given to the preparedness for, prevention of, and response to emerging infectious diseases, EIDs. Between 2005 and 2016, 3 national strategic plans were drawn up and implemented. Currently, the 4th plan, that is, National Strategic Plan for Emerging Infectious Diseases, 2017 to 2021, is being implemented, emphasizing systematic, efficient, and timely actions through multi-sectoral coordination regarding knowledge management and integration of efforts based on previous experiences and lessons learned. Antibiotic Smart Use ASU program to promote rational use of antibiotics in hospitals and communities. พระพุทธบาท Hospital and ตำบลหลังเขา Health Promoting Hospital in Saraburi Province. พระพุทธบาท Hospital is a state-run general hospital located in Phra Phuthabat district of Saraburi Province in central Thailand and about 200 kilometers north of Bangkok. In Thailand, the overuse and misuse of antimicrobials among the people and some health personnel are still a problem. As for this hospital, there are some interesting stories about resolving such a problem, from policy to practice, as follows. Multidisciplinary coordination is the key to operations. The Pharmacy and Therapeutics Committee, PTC, or the Pharmacy Committee of the hospital, is the core body in resolving the problem related to irrational antimicrobial use and antimicrobial resistance in healthcare facilities. The committee comprises multidisciplinary medical and health professionals. Today, a PTC meeting is being held to consider and review the use of medicines in the hospital, that all relevant departments are involved. At this meeting, the pharmacy department presents statistics on antibiotic drug use, which reflects such use at all units, leading to drug use guideline revision and better coordination in this regard. Multidisciplinary working is the key to success. Dr. Kampon Gosin Prakan, Head, Internal Medicine Group, said, "We have been implementing the Antibiotic Smart Use ASU project that promotes rational drug use, RDU, which is a policy of the central administration, for example, the Ministry of Public Health. The project is implemented through the medical staff organization of the hospital in coordination and consultation with other relevant units in a continuous manner, regarding the working mechanism by doctors or members of the medical staff organization." Dr. Kampon said, "Here, as a doctor and prescriber, I have found that antibiotics were normally overprescribed by new medical graduates or interns working at the outpatient department, OPD, who still lack experiences. Luckily, our medical staff organization is strong, and we have held talks with the young doctors to adjust their attitudes and concepts continually. The outcomes are positive, and the antibiotic use has been in the same direction." At present, for the patients whose antibiotic use is deemed unnecessary, their antibiotic prescriptions have been withheld, but herbal therapy is used instead after informing the patients of such benefit. The treatment outcome is closely monitored so that the results can be used as our knowledge base and further research. That will lead to the modification of the drug use policy in the future. Regarding the role of the nursing staff organization in the hospital, in practice, nurses are closest to inpatients in the hospital. One of the nurse's major roles is the management of drug administration on inpatient wards. Caring for patients on the wards covers several dimensions, including monitoring the symptoms of the patients after the drug has been administered. That will be related to the prevention and control of drug resistance in the hospital. Various data will be recorded or entered into the system, which will be followed up by the pharmacy department for use in evaluating the use of medicines in the organization. A registered or professional nurse at the ward said, "We are in charge of checking whether the use of prescribed antibiotics is in accordance with the established criteria, how the patient's symptoms respond to the drug, and how the lab results indicate about drug-resistant organisms. We have to monitor and inform the doctor of such information so that the drug use can be adjusted. That will be related to the control and prevention of the spread of drug-resistant infections." One important factor related to the control and prevention of antimicrobial resistance in a healthcare setting is the detection and confirmation of infections. Here is the hospital's laboratory that supports the decision-making and planning of the hospital on this matter. The information from the lab is used for the management of drug use. Where medicine is, where pharmacists are. Another important role in the monitoring of drug use by various units through the Health Information System is undertaken and coordinated by the Pharmacy Department. Such monitoring data are collected, processed, or analyzed, and reviewed as per the role of the hospital's Pharmacy Committee. Pharmacist Nopawong, head of the pharmacy group, Praputabat Hospital, and secretary of the Pharmacy Committee, said, "The data on drug use monitoring will help us know which units do not pass the drug use evaluation criteria, and if so, on which aspect. Then we have to determine how they should be improved. The data or information is derived from the file system database that every unit has to record. According to the database, we know how each unit or professional group uses antimicrobials. We see the relationships of all units from the figures on the use of each antibiotic drug." In performing its duties, the Pharmacy Department will hold a meeting to monitor and evaluate the performance of each unit. And based on such information, each unit is expected to improve their drug use directions so as to ensure the efficiency and quality of therapeutic care, in line with the hospital's budget management principles. Besides coordinating the rational drug use effort in the hospital, another role of the Pharmacy Department is public education in the community. Today, a mobile drug awareness unit is organized to promote the rational use of drugs, including antimicrobials, at a sub-district or tambon health promoting hospital under the supervision of the hospital. That is in line with the strategic plan for the management of antimicrobial resistance, which also aims to enhance the knowledge and awareness of rational antimicrobial use among the people. Assistant Professor Dr. Totsapon Siri Sopikun, Director, Praputabat Hospital, said, "Fortunately, When we had a financial problem, the adoption of the Rational Drug Use (RDU) program has helped us reduce the use of antimicrobials. Both the patients and the hospital benefit from such practices. The cost of antimicrobials has more or less reduced. That is acceptable. As administrators, we have to understand that the policy has been clearly laid down, and then we need to communicate with all concerned to make them realize the common benefit of this effort, especially recipients' health. As for the Antibiotic Smart Use ASU project, Sub-District Tambon, Health Promoting Hospitals, THPHs, the frontline healthcare setting of the Thai public health system, are pilot project areas that are important in resolving the problem of antimicrobial resistance. This is Tambon Lang Khao Health Promoting Hospital in Muok Lek District. It is one of the 87 sub-district hospitals in Saraburi province and one of the 13 sub-districts in Muok Lek District that implement the ASU project. At present, the sub-district hospital has stopped using antibiotics for treating 3 common illnesses: acute upper respiratory infection, diarrhea, and lacerated wound. But other remedies such as herbal drug, Kariet or Fa Thalai Chon, are used instead for common cold. The ASU project was initiated in 2007 with the focus on creating understanding and transferring the knowledge for changing antimicrobial use behaviors, including misuse and overuse, among health officials and service recipients. Initially, the effort targeted healthcare providers to serve as a role model and then was extended to the people through multi-sectoral coordination with relevant non-health sectors such as local administration, education, and civil society. Kesini Kongsomboon, former director, Tambon Lang Khao Health Promoting Hospital, said, "At the beginning of the project, we had 4 cases of antibiotic allergies and 1 death due to bloodstream infection. And health officials and the people had a misperception and overuse of antibiotics. After the ASU project was launched, we gained the correct knowledge of antibiotic use based on the concept, no antibiotic, no neglect, and keep following up. To ensure project sustainability, we realized that we could not work alone. The networking principle was adopted despite resource constraints. At present, we still follow such principles." Creating correct understanding and attitudes towards rational use of antibiotics for the people is important and has to be undertaken continually. Today, making field trips of sub-district hospital staff and village health volunteers who have been well trained in antimicrobial use is the reflection of the project's working principles. Enhancing knowledge, not neglecting patient care, and following up on movements in the community has helped health officials to know whether antibiotic use still exists in the locality or to which direction such drug use has changed. Mrs. Buarian, a villager of Lang Khao village, said, "No, I don't take any antibiotics, but I take herbal drugs instead. It is good that a village health volunteer visited me and gave me useful information about antibiotics. I was also given a booklet on antibiotics and told how I would be affected if I took such drugs." Creating motivation is important for community-based activities, such as the Community Involvement Project, for promoting rational use of antibiotics. Under this project, there will be quizzes for the people about antibiotic use, no matter what their answers will be, either right or wrong. they will get a score to be accumulated to exchange for a piece of consumer products. Although the products are not of high value, the game can help the people to have a better knowledge of antibiotics. Networking and joining forces in moving forwards. Taking actions everywhere, every time, and every opportunity is the key to success. Whether there is a community gathering, it will be a chance to keep educating the people or participants on proper use of antibiotics in a continual and sustainable manner. Today, at a meeting for local administration officials, the sub-district hospital staff will give a talk again on antibiotic drug use. At today's event, the Chief Executive of the Muak Lek Sub-District Administrative Organization and the District Health Officer of Muak Lek District are also participating. Both of their agencies are supportive of community health education activities regarding antibiotic drug use in terms of policy and funding. Mr. Prasit Mi Kao, Muak Lek District Health Officer, said, "The key to success, firstly, is the responsible officials. They need to have a good understanding of this matter and love for it. After implementing it, they need to keep following up on their actions and realize the benefits of the efforts, and the administrators have to attach importance to the project." As for Thailand's local administrative organizations, they have actually allocated a certain amount of budget for various public health activities. Patima Sangkhamani, Chief Executive of the Muak Lek Sub-District Administrative Organization, said, "We have realized the importance of this matter because I had allergic reactions to antibiotic before. Upon becoming the Chief Executive of the Muak Lek Sub-District Administrative Organization, we have joined the Rational Antibiotic Use Campaign and allocated some budget for its public relations activities, with partial funding support from the National Health Security Fund. We also coordinate the funding support from other agencies." Dr. Chuchai Sonchamni, Deputy Secretary General, National Health Security Office, said, "The National Health Security Office, NHSO, has measures to provide financial support for healthcare facilities to carry out their health promotion and disease prevention activities, such as rational drug use. The support for local activities is rendered through the Local Health Fund, whereby the capitation budget is partly allocated by the NHSO and the rest by the local authorities." This is an example of the effort for turning central administration's policy into action at the local level regarding rational use of antibiotics according to the local context, which may be dependent on different factors of each locality in Thailand.